I am researching cognitive therapies with a large focus on the cognitive behavioral therapy. A cognitive therapy is one that teaches people new, more adaptive ways of thinking based on the assumption that thoughts intervene between events that take place in our lives and our emotional reactions. These therapies assume that our thinking colors our feelings. For example, a depressed person would take a suggestion as criticism and would think that someone who is acting friendly towards them or trying to be their friend as pity, which involves all negative thoughts constantly running through their minds. Cognitive therapists believe that if such thinking patterns as those can be learned, then they can also be replaced by other thought processes, which is why their job is to try to teach people new and more constructive ways of thinking to help change their mindsets. The cognitive perspective on psychological disorders explains that our emotional reactions do not stem directly from the event that takes place. However, they come from our thoughts that are in response to the event. Some important terms pertaining to cognitive therapies are the rational emotive behavior therapy, which is a confrontational type of cognitive therapy developed by Albert Ellis that vigorously challenges people's illogical, self-defeating attitudes and assumptions, and does that by having the therapist change people's thinking by revealing the absurdity of their self-defeating ideas, which will enable healthier behaviors because they will stop being so hard on themselves once they realize that they shouldn't be. Stress inoculation training is also an important term because it deals with teaching people to restructure their thinking in stressful situations, which was introduced by Donald Meichenbaum to try and change negative self-talk. For example, students who put themselves down before a test that they are anxious for. And cognitive behavioral therapy, which is a big tying factor with cognitive therapies, is an important term because it's a very effective and popular therapy that integrates cognitive therapy, which is changing self-defeating thinking, with behavior therapy, which is changing behavior, which alters the way people think and act and is a widely practiced therapy. Many sources have confidently stated that cognitive therapies are very effective, with a large portion dealing with the cognitive behavioral theory because it is action-oriented, practical, rational, and helps the patient gain independence when dealing with real-life issues by teaching them self-helping skills that are used in homework, assessments, in a sense that will help change the way you think, feel, and behave in the present time. The response rates in studies of cognitive therapy show very high results because they're helping the patients with depression while ensuring that they won't have the negative side effects of medication to help with their problems, because they typically are not taking the medications at the same time as the treatments and won't have those side effects to give them the possibility of relapsing. This therapy is also one of the most widely used of all types because it's so effective and popular compared to the others. People with anxiety and mood disorders and people with obsessive compulsive disorder are most likely to be helped using this type of therapy because people with anxiety and mood disorders both have problems with emotion regulation, so an effective cognitive behavioral therapy program for these specific emotional disorders would train people to both replace their negative thinking with more realistic appraisals and to practice behaviors that are incompatible with their problem. For example, those who fear social situations would most likely be assigned to practice approaching people such as in a party setting or just a social gathering outside of their house. In cognitive therapies regarding OCD treatment, people learn to prevent their compulsive behaviors by relabeling their obsessive thoughts. So, for example, they would be assigned to do something enjoyable for 15 minutes instead of giving into the urge that they might have. For example, if they had just washed their hands and then wanted to wash their hands again right after because they felt like they needed to. So instead, they might play an instrument or read a book instead and tell themselves at first not to give in by saying that they are just having a compulsive urge. And by realizing that from the treatment, they can then lessen the symptoms. These therapies are also used largely on substance use disorder, depression and dysthymia, bipolar disorder, eating disorders, anger and aggression, and personality disorders. Some statistics found in articles on this therapy are that up to 2/3 of people with depression don't respond well to antidepressants, but instead receive more help from the therapy treatments. After 6 months of treatment, researchers found that 46% of those who have received cognitive behavioral therapy reported at least a 50% reduction in their symptoms. The treatments help to improve patients' quality of life and reduce suicidal thoughts in many patients. And it focuses only on the present and not on the past or childhood experiences at all. Also, it is a great relapse prevention technique for substance abusing patients coming out of rehab. Some myths regarding this therapy are that cognitive behavioral therapies only treat symptoms and not the whole person, which is untrue because while symptom reduction is among the therapy's goals, all the success comes from treating the whole person. Another myth is that cognitive therapists believe that the past is unimportant, which is not true. They are very interested in their patient's past, however, they don't put as much emphasis on it as does traditional psychotherapy, although they do realize that a person's past experiences do make them who they are, so they do have to take that into account. And lastly, the cognitive behavioral therapies are limited by available scientific evidence, which is a myth that is also untrue because although some therapists will often use some form of data to help drive the treatment, such as mood and thought records or assessment questionnaires, they are not limited to these at all and like to focus on creativity and artistry aspects as well. Some interesting facts about this therapy are that Missy Elliott, Ellie Goulding, Sarah Silverman, Emma Stone, and Jennifer Lawrence, who are all talented and successful famous women, suffer tremendously from anxiety and might benefit from being treated with cognitive therapies, and that this therapy is usually recommended as the first line of treatment for the majority of children with psychological disorders. Here are some specific resources and articles that may help to better explain this therapy type, and a link to a YouTube video that describes it accurately as well. Thank you for watching. I hope that this video helped you to better understand cognitive therapies.